The most prevalent disease of humankind actually is a gum disease. They even tell us that, especially for the A1C high patients, simply just do what we call deep scaling, root planing, or phase 1 gum therapy, we can drop at least 1% point in terms of A1C without changing any other medical treatment.
This is Doctor Talks.
Welcome to another episode of Reversing Your Type 2 Diabetes Summit 2.0. This is your co-host, Dr. Yin Hsu, and I have the pleasure of introducing a friend and a colleague of mine, also by the same last name as Dr. Hsu. No relations, but deep friendship, if you will. And Dr. Hsu is an ultimate professional. He's a dentist who has been seeing patients from all over the places and with all kinds of backgrounds for many, many years. So I'm going to let Dr. Hsu introduce himself. Dr. Hsu?
Hi, how are you? Good morning, everyone. My name is Yin Hsu. Yes, Dr. Hsu said, as a matter of fact, I'm a very long time patient of Dr. Hsu's. So I the whole career, I'm growing up with Dr. Hsu as well. So personally, I got my first dental education from Taiwan. So I immigrated to this country pretty much after my graduate education. And then I renew and update my dental license here, study a little bit about public health. And then I start practicing, also teaching part-time at Tufts Dental School in Boston. My main concern, my main interest started with just restoration, how to rehab the patient. Today's technology with all kind of advancement, we get a lot of fantastic replacement of the damage. But again, after you keep on doing those mechanics, and also we see patients regularly, and then you realize that some oral condition, it's not just a replacement. We have to get down to the root cause. And then, of course, dentally speaking, two major conditions. One is dental caries, one is gum disease. That's why people are concerned. And then especially on the gum disease front of perspective, because at least 50% of our population come to dentists regularly. So I think by doing this for more than 25, almost 30 years, you can see the progression of a patient's oral condition. And of course, just like any other things, it goes up and down. It has seasonal things. He has patients' personal life change things, a lot to do with patients' lifestyle. And then we found out, because the most prevalent disease of humankind actually is a gum disease. Pretty much, we're thinking that more than probably a third of American population suffer from so-called gum disease. But there are a precursor of that, which is the gingivitis, which is much more prevalent. And then, so when you have those low-grade inflammation in or on the gums, if you stretch your gum tissue flat, that's equals to the size of your palm. If you think about that, if you wash your hands, your palms start to bleed. I think that's kind of shocking. But that's what happens every day in those little minor inflammation. And then the recent study even tells us that, especially for the A1C high patients, if simply just do what we call deep scaling, root planing, or phase 1 gum therapy, we can drop at least 1% point in terms of A1C without changing any other medical treatment.
So that's Dr. Hsu, yeah, that was so helpful, as in sort of kind of the opening for us. And for a lot of our listeners, they may not even be aware of this link between oral health and systemic health. Maybe we start with that.
Yes.
Why do people with diabetes have to worry about their gum? Are they at a higher risk for developing oral health challenges?
Yes, absolutely. If you have those low-grade inflammation on the gums, we know for sure it's going to increase C-reactive protein. Also, you can think about that a little bit more, simply to look at it. Our gum tissue are semi-permeable membrane. So it's actually the first contact of the environment. And then if we have a lot of inflammation, that will increase the permeability of that membrane. And then a lot of, just like a leaky gut, I think the leaky gut actually started with the mouth. And then you have more
Mm.
prone to the exposure, and then more inflammation. And those inflammation, as far as I understood it, systemic circulation go through your mouth probably every 20 minutes. You think about it, keep on
Oh.
being all those inflammatory cells all over the body.
Very interesting, right? So you mentioned that the oral cavity is actually the beginning of the GI tract,
Right.
and so the leaky gut, they actually it starts with the mouth, and
Yes.
that's an interesting concept. Now you
Yeah.
mentioned CRP earlier, just for our
Yeah.
listeners' sake, that's a inflammatory marker. So you're saying that because there's leakage
Mhm.
between or there is a transfer of these inflammation in the mouth gets transferred into the system.
Yes.
So well, if you don't take care of your mouth, the inflammation in the mouth may go into becoming inflammation in the
Yes.
body. Is that what you're saying?
Yes. Yes. Absolutely. And then there are numerous evidence showing that proper oral hygiene maintenance daily can have a good preventative effects on the cardiovascular disease. Today, we even talk about potentially Alzheimer. Of course, we just mentioned about A1C. I think they're all in the same pot. I think, there's so many factors. I think that basically, I think since we have the system set up in this country wonderfully, everybody should utilize their access to their dentist, at least get their gums checked, and then including something very always ask the dentist, how is my periodontal pockets look like
Mm,
today? How much area of my gums are bleeding? Or those are the indication. In general, we don't want pockets more than 5 millimeter deep. And then in general, we don't want 30% and above of your gum area that's bleeding on touching, on probing by the dentist. So that's in general, we consider that's a healthy status.
mm. This is actually really interesting, right? So what we're saying is that there is a convergence of healthcare providers, including the dentists, participating in the whole body health, right?
Yes.
So now dentists not only are caring for people's mouth, but now there's a relationship to systemic health. And
Yes.
this is actually astounding. Now, Dr. Shu, I've always known you to be a pioneer. I've known you to be an innovator in your own space. But do your other dental colleagues aware of this systemic oral relationship, or this is something that people need to seek out specific dentists for?
I think in general, I mean, identically, colleagues are well aware of this general condition, but there are some breed of dentists like myself probably like to spend a little bit more time in terms of patients' general condition, including their mental condition, including, I think most important is their diet condition, because I consider myself an older generation. I mean, when we were in Taiwan receiving the dental education, there's very important parts about diet counseling, diet analysis. When I first came to this country, went back to school, updating my degree. That was in the early 1990s. I think we have a full semester of nutrition, but today I think they decreased down to maybe just few hours. Unfortunately,
Oh,
I
that's
think
too bad.
I think
We're actually seeing that. We're actually seeing that in medical school as well. This is
yeah,
such
yeah.
this is a bad trend.
Yes, yes, I think because we have so busy into those mechanic things, we know we can do a lot with the disease population, but then we are treating the disease instead of treating for the health. I
Mm.
think that's a little bit
So
concern.
So is there a category of dentists? I mean, how would you describe yourself as the dentist that are not only focusing on the mechanical sort of solutions, but also addressing the systemic health and nutrition, the aspect. Is there a category, or maybe there isn't?
There isn't, but I hope there's something called integrative dentistry. But I already heard that coming up, just like the integrative medicine. And
Mhm.
actually, we know our own stuff, but we also should be more concerned and learn about other fields of the medical, contributions. And then so the my main goal is to see my patient being healthy, I think that's the most fulfilling part of my career. It's that not so much in how many holes can I drill in this patient. I always joke with my patient that let's watch these holes to see if we can maintain that and then not getting bigger, not needing a root canal eventually. So I think that's just my personal, also is my calling as well.
Yeah,
So
such a refreshing thought here. So let's come back to
yeah,
kind of the relationship between diabetes and periodontal disease. You've mentioned earlier that it's truly a bidirectional relationship,
yes,
right? So
yes,
people with diabetes have higher risk for developing periodontal disease.
yes,
And on the other hand, higher or more severe periodontal disease actually would elevate patients' blood glucose. Is there a
yes,
fair statement?
yes.
And
And, and
can you maybe address a little bit about why is there such a connection there? Why do people with diabetes have higher periodontal disease?
so basically, uh, you 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 have more inflammatory components in your system. And
Hmm.
also you know, I have to, including myself, long-term diabetic patients. I know that sometimes our food choice, you know, not only can affect our A1C or metabolism, also affects our oral flora, which is the bacteria in the mouth. And on top of that, if you have the initiation of the inflammation, the gums start to get swollen, and then the pocket gets deeper, and then you become more anaerobic bacteria in the mouth. And we do think that there has something to do with the shifting of the whole microbiome in the digestive system. I think the rest
Hmm.
probably know about that. So, and then what we want to do in the mouth is, I wish that we can take out the whole cardiovascular system and then do a cleaning, but
Mm.
one day we can do that. But at least we can clean our teeth
That's so
regularly,
true.
and then
That's so true. Yeah.
maybe help our body a little bit. So, and then I think and also I think a lot of diabetic patients probably, frustrated with their whole mental health as well. Sometimes they're just not eating correctly. And then also the dry mouth and, you know, also dehydration, dry mouth also facilitate the gum inflammation as well. Especially today, we have on top of that a lot of upper airway restriction because
Mm.
of environmental allergy. So those all contribute to dry mouth. Dry mouth also facilitate the gingival inflammation. So it become a malicious cycle, and then
Very much so. Yeah.
we have to break it.
Yeah, yeah, for sure. So let's get down to the basics. Okay. He is among our listeners, there are many people who live with type 2 diabetes. How often should they see their dentist? By the way, there are surveys in the US that says people actually see their dentist more often than they see their doctors. So
Yes,
so in fact, you become kind of the primary care healthcare
yes,
provider
yes.
for many people. So how often should they go, and what do they do when they go see you?
So in general, I mean, most of the people that have dental benefits or insurance benefits, as we call, the insurance company recommend every 6 months. But actually, that's not evidence-based. But we
Okay.
know for sure, very interestingly, that I quoted from the old study, probably in the early 2000s, they found out that the A1C 9 and 10 patients for decades. And the endocrinologist has done everything, including their medicine, insulin, whatsoever. They couldn't lower it. If they suffer from gum problems,
I see.
simply just go through a deep scaling cycle, what we call phase one periodontal therapy. They can drop their A1C by 1%. And that effect
Yeah.
lasts about 3 months. So and
Hmm.
all the study pointed to the frequency should be 3 months for the high risk patients, especially the periodontal in the diabetic patient. They should have that unless they are so well maintained. As I said, their bleeding areas less than 30%, their dental pockets are less than 4 millimeter. Then those people we consider that just as healthy as general public, they should go every 6 months. That's fine.
So there insurance that covers more than twice
Yes.
dental cleaning?
Many insurance will cover 3 times. And I think that coming out of consumer, I would highly recommend, the consumer need to ask for it. And then, but in general, if the patients, I hate to use the word qualified because insurance should not dictate what are, what I meant, the medical behavior. But if we think that a patient is on the higher risk, for example, they are periodontitis patients, usually insurance will cover every 3 months. So after,
Every 3 months.
in
Okay.
general, go by like if you did the deep scaling and then they will cover every 3 months, which is evidence-based.
Now you use the term deep scaling. It sounds
Yes.
scary. Well, what
Yes.
does that involve?
So basically what happened is you think about that, if we just clean your teeth, everybody had that experience. Sometimes you may be a little sensitive. Usually those area you have some gum recession. And then, so what I'm talking about is if your measurement, the pocket is more than 4, actually hygienist has hard time going deeper than 4 without hurting you. That's why we want to actually put a little bit local anesthesia. And usually we do, half the mouth at a time. And then, so that's why we give the term deep scaling. I totally agree. We should change that verbiage because it sounds not very welcoming. And then in the dental term, we call that phase 1 therapy, periodontal. So basically, I think for general public, they should always ask their dentist, how is my pocket today? How is my bleeding condition? And usually we would tell patient another thing about their plaque control, how well they brush their teeth. And then personally, I really go through what they eat because sugar probably is one of the thing that, so basically you can do all the oral hygiene, you can do the fluoride treatment, but most effective way of preventing dental caries especially is actually sugar restriction. So that today, if you tell the patient don't take candy, it's so old. So I think that's what I'm so in love with this FMD and this fasting mimicking diet concept. I think those are very, very good treatment not only for the general health, and that's actually the most effective way to reduce dental caries.
So you're talking about a sort of an innovative nutritional approach, and you mentioned the fasting mimicking diet. Maybe we go there for a few minutes. Tell us a little bit about what is fasting mimicking diet. It seems like a little bit of a contradictory, right? Fasting, and then there is a diet in there.
Right. So basically what happened is this. Let's just talk about sugar and caries. I think we are more more damaging is not how much sugar you take at a time, is how frequently you do. So
Oh,
that's the
interesting.
thing
That's an interesting
about,
concept.
yes, of course, you take too much sugar, we're talking about simple sugar, that definitely bad for your metabolism, loading of the system. But just give you an example, I think prior to 1940s, 47 to be exact, the diet counseling is a very important, intricate part of the dental education. Something happens in 1945, the great discovery of fluoride. I think just like the discovery of the insulin in the turn of the century, they changed the behavior of the dentist. No longer we're telling the patient not to take candies. Would you say do fluorides? So I think fluoride at best reduce dental caries about 50%, but sugar restriction can be as effective to 80 to 90% of a caries reduction. And so MD, it's very hard to tell patient not to have candy, almost like, patient won't take that. Oh, that's an old record. I heard that before. So I think you look at today's diet, I think the most convincing to me is FMD because FMD doesn't have any sugar in it. And it also give your body a chance to really loosen up the inflammation. I think that because the restriction and selection of the food during that time of a fasting week, you actually improve your gum health, although that's anecdotally, but when people are doing that kind of thing, they actually take care of their general health and including oral health as well.
Yeah, it's very interesting because intermittent fasting right now it's all the rage, right? There's been a huge popularity.
Right.
It's estimated that more than 10% of Americans is doing some sort of fasting.
Right.
This fasting mimicking diet And so it's quite a fascinating innovation. It's essentially nutrition, precision nutrition that gives you the benefits of a 5-day fast.
Right.
So you're actually not fasting. You're getting the benefit of fasting while probably getting some nutrients. This whole area of fasting, I think there's actually a study, Dr. Shu, that I know of that is looking at the fasting mimicking diet's effect on periodontal disease. That's
Wow.
actually
Okay.
being carried out at the moment. So now it looks like the field of dentistry and medicine is coming all, even more closer together because the mouth is part of the body. And,
Exactly.
I think our society or our medical discipline kind of split the two, but in fact, there should be, I mean, there is definitely a connection in the end. And so let's summarize a little bit about our discussion so far. That there is a bidirectional relationship between periodontal disease and type 2 diabetes. People with type 2 diabetes have higher rates of periodontal disease, and people
Yes.
with periodontal disease happen to have higher A1C or blood sugar. So this relationship must be broken. And I think Dr. Shi, you mentioned that seeing the dentist more often for surveillance, for dental cleaning, if
Yes.
necessary, deep cleaning or deep scaling, as you call it, would be important. So I'd like to finish off by really focusing on the nutrition back to this very important thing. Nutrition has the benefit of improving metabolic health, but also improving periodontal disease. Um, um, but dentists are busy, right? How do you impart that education in your practice, especially on nutrition, fasting, and et cetera? When do you have the time to talk to patients about it in
Uh,
your own practice?
Usually, I have a lot of a reference on my bookshelf. So that's the first introduction of my practice. And second, I really, just like yourself, every time I went to see you, we came out with an action plan. And I'm sure that most of dentists give a patient action plan too. But in my action plan is also includes about the nutrition because as much as you probably know more than I do, a lot of people has taking SSRI, taking all kinds of medications. And a lot of time they just need to reset their nutrition. They may be helping their sleep, helping the general health. And then especially, I think I learned from you last time in your summit, you said that the insulin resistance probably is longer than 15 years before your metabolism start to show symptoms. I think the dentist can play a big role on that. When we see
Mm,
a lot of uncontrolled gingival inflammation that you couldn't explain, maybe we'll have to think about that. Is there some components of insulin resistance in it that contribute? I think it's all about prevention.
mhm.
And then so that's just I think that's what I think. Yeah, that's important.
So, Dr. Shu, our listeners who is living with diabetes, what advice would you give him or her when our listener goes to the dentist? What should the listener do? What should the listener ask?
Yes, definitely they want to ask how much inflammation I have in the mouth. All right. As I said, two very simple things. We call that bleeding probing, which it shouldn't be bloody. You wash your hands, that shouldn't be bloody. We do a dental cleaning, that shouldn't be bloody as well. And how much is that? That you need to ask the dentist or hygienist. Second, we should ask again, you want to ask the charting of the periodontal pockets. Most of I think, should be 100% of dentists should provide that information. Look at your pockets. You can look at those red numbers. Those red numbers you should see more than 4, which is millimeters. And then you should ask, and then so what can you do about that? And then if people have those two, you want to see if you can qualify for 4 times or 3 times annual cleaning instead of 2, which is just the tradition insurance coverage. And I think that's the basic thing that we should do. And then if your dentist happen to be into the nutrition, which I know plenty of them, they like to talk about that because it's in our blood. We need to talk about nutrition. We just don't know what to do with it. And I think today we have the technology like the FMD, like this summit is about. I think that's a tool that we should use. And then in my practice, and then the moment that I talk about autophagy, they talk about renewal, because gum is a part of the skin. If it's good for
Uh,
the skin, I'm pretty sure it's going to be good for the gums. And
That's
then
a good point.
and then maybe people don't see their gums. You say that that's part of the skin. They want to look younger outside and younger inside as well. So I think many of my patients was interested doing the same thing.
Oh, what an interesting concept.
And
Yeah.
every dentist should try to do it and do it with the whole office staff. That's what we were doing. So
Oh, that's
patients can
fantastic.
see the staff are losing weight, they're looking better. Everybody say, what's the secret? And there you go.
That's amazing, Dr. Shu. What a inspirational discussion that we've had, and so helpful as well. Very practical, right? So our listeners, when you go to see your dentist, if you haven't, make sure you go and ask these critical questions. Dr. Shi, if our listeners want to look up your information and look up your type of practice that you have, and by the way, where are you anyways?
Oh, currently my practice in downtown Boston, looking at the Boston Commons, and then my office is called Suffolk Dental Group, which is the location, Suffolk County. So we do have a suffolkdental.com as a website, or people can contact me with my email, which is my name, YINHSUDMD@gmail.com. And then you probably can, we are adopting a new system on the website that I can have a direct conversation with my
Wow, you make yourself so accessible. Thank you, Dr. Shu. You're one of a kind. So our listeners, thank you. This will conclude our today's episode, Reversing Your Type 2 Diabetes Summit 2.0. Thank you.
Thank you. Happy fasting.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks. Real talks from real doctors on the issues that matter to you most.